We have some very good therapies. We need probably more, and probably some more powerful therapies in order to attack cardiovascular disease. In order to do that, my guest today says we really need to understand better the pathophysiology, the molecular mechanisms of cardiovascular disease. And I'm very honored once again to be back with Professor Gregory Lipp, who is at the University of Birmingham, and we're talking about a JACC State-of-the-Art paper, and it's called Monocytes in Coronary Artery Disease and Atherosclerosis. Where are we now? What prompted you to do this state-of-the-art review for JACC?
Well, we do know for many years now that inflammation is associated with cardiovascular disease, and we have much research has been directed to try and measure various inflammatory biomarkers and mediators. Perhaps we sort of neglect something more fundamental, looking at the white cells, which are obviously a component of the blood. And white cells, a subset of that are, of course, the monocytes. We do recognize now, considering various numbers of studies, how monocytes are not just a homogeneous group of cells. There are different subtypes even within the monocytes. In cardiovascular disease, there's certainly been a distinction between 3 monocyte subsets. And they have different roles in the reparative process in related to cardiovascular disease, for example, post-myocardial infarction or acute coronary syndrome. Some of them obviously have a role in mediating inflammation. And what has been shown very much from our own work, from our own original data, how some of these monocyte subsets perform in the setting of acute coronary syndrome, as well as in patients, for example, with heart failure, and also in patients with atrial fibrillation. Now, this we feel in terms of the relationship between monocytes and different manifestations of cardiovascular disease, it may well open as a possible therapeutic target ultimately. The state-of-the-art review is to try and put it all together, the totality of the data which has been in this area. Some of the previous work have, in a sense, have failed to recognize some of the differences between the monocyte subsets. Interestingly, in animal work, the existence of the different subtypes of monocytes was hinted at. What we're now showing in some of our work and some of the other colleagues from around the world, showing how some of these actual monocyte subsets also mean something in human cardiovascular disease.
And it's been a little frustrating because when some of the research that's been done of like anti-inflammatory agents, they just haven't worked.
That's, in a sense, that's right, because much of those targets have been to, as I say, what we measure as biomarkers, but essentially, to put it very simplistically, they're almost like floating chemicals in the bloodstream. So much of the therapies which you mentioned have very much tried to target those, for example, to work on C-reactive protein or something like that. What now we are instead targeting actually are circulating cells, or what we can look at perhaps is to have more attention on these circulating cells within the bloodstream.
So the reason that we need to be looking at this article now is what? To get us ready to understand some of the mechanisms, maybe trigger some research ideas?
Absolutely. And we also have some work which is just about to come out, also looking at the role monocytes play in angiogenesis, and that's obviously new blood vessel formation. I mean, and that may well provide a key why some atherosclerotic plaques, just as an example, become unstable.